indivisible, with liberty and justice for all.
Don't fit the hatch.
This time it was a solar panel, but we got it with the hatch.
So this is the whole correction.
Prepared.
Yeah, it's removed and being armed.
Okay. Welcome, everybody. We need to approve the minutes.
So moved.
Second.
Second.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. AT1, there is a new revision. On that. Four. You have one?
I don't know.
Okay, everybody got it? You're up.
So the change is that we said it was new this year. This is not a new program. The healthcare worker bonus did start in 2022. And this is a resolution requesting to add the funds of $1,614.75 to the preventive budget. We have one staff member that meets the requirements for eligibility to receive this healthcare worker bonus, and these funds are fully reimbursed through New York State Department of Health. Or New York State, excuse me, not the Department of Health.
Make a motion.
Motion? Second. Any discussion?
Is this the second round then of this for them?
No, this one staff member, there will be another one in the next coming months to get her second round. So it's $1,500 payment, and then as long as she continues to qualify and work during that time, she'll get another $1,500. It's a total of $3,000.
Now, first of all, they have to qualify by either being a nurse, LPN, or a social worker.
That's correct.
What's the other criteria for getting them? They have to do billing, is it because of who's billing through Medicaid? Medicare?
No, I believe they just have to work.
Yeah.
It's really just, they have to be employed, work 35 hours a week, and never received the bonus in the past, which she didn't at her previous employer.
Oh.
That's why she does qualify. When they qualify, the information goes right to HR, and HR lets us know when the funds need to be moved to our budget line. This is not just for the health department, the jail nurses, and if there's any social workers at DSS, they have all received this also.
How long has she worked for us now? He or she?
A year, yeah. She was a year in
So she
October.
came in 2023. When did our people that were there at that moment, that snapshot, they got paid then, right?
In 2022, yes.
Okay. I'm still, and I know you said it's state reimbursement, and I mean, state pisses away more money than what. But the thing is this, bottom line, she didn't work for us. And I'm not saying, I know it's state money and everybody forgets that it comes out of your pocket anyway, and I get that, but my taxes are pretty high, so I appreciate that. But the thing is, I always look at what the rest of the people see, the rest of our employees. And it's almost like there's a disparity. That's my problem with this. Because, and remember when this rolled out a couple of years ago, it was supposed to be the frontline workers that, you know, were facing the public and like that. Yet we had social workers that had to face the public just like the...
Social workers get it.
Pardon me?
The social workers get it, but I did have a lot of staff my finance staff, the front lines of COVID during vaccination clinics, they did not receive that.
See, that's my point. That's what it was for, because of that, like when we're around, you had people who were facing these, and I'm not comparing one to the other, because I'm just saying, look at the individuals. They had to face the public also, and there was a concern about everybody getting COVID, and I must be the only person here who never got it. But the thing is, it just doesn't fit, that's all.
Yeah, it's not an equitable program for the situation, but it's the state is dictating this is what it's for. We had workers that got $5,000 bonuses for in-home health care, and the office staff, who every day the office was open, didn't get a dime. And actually had more of a risk than someone who worked with just one or two people. Didn't get a dime. It's just the way the state set it up and divided it and said, this is what it is. I don't think anybody did. I think if you were to ask, I think everybody in the department should get it.
Absolutely.
We don't
I mean, if they were working with the public, they should.
That was discussion back then.
Oh,
when it
yeah.
first came out, about whether we were going to accept it or not. Because it didn't go to everybody.
Right, if you didn't accept it, we would have received the fine.
Right.
Yes.
It was awful.
The only flip side that's not as equitable is they do get the other bonus that we set up as a legislative body this year. What was that? Is that 1,500?
I believe so, yeah.
And that goes to all the employees. That's in the budget. We already set that up. Yeah, this is one of those things you have the discussion. If you don't give it, it goes back to the state. They're going to give more money to somebody else. You're just not going to get it. Anybody else? Okay. Do I have a motion?
You did.
Oh, we did that. Okay.
Just need a vote.
Well, I'm older than I was yesterday, so.
Oh, stop it.
All right. All in favor?
Aye.
Opposed?
Same.
One abstention? Okay. Thank you.
I'm up.
Your report now. This is simple.
I'd like to do the county health ranking first, because my report I can shorten if needed. So, I think that. Wait a second.
Thank you.
You're welcome. Thank you. So the county health ranking help us understand how long and how well that we live. This presentation will highlight the county rankings report to include areas to explore and areas of strength in our county.
Is the 49 out of 62 good or bad? Is it better to be at the top of this list or at the bottom?
Not better than what it was. We used to be at what,
Top.
Dead.
60?
We were
61?
last.
62? Last one time. When I came 10 years ago, yep.
So we want to have a lower.
Yeah.
Going in the right direction. Put it that way.
It's like a golf score, Mark.
I know, it's hard to tell. I was thinking we should be 62, we should be fighting for that, but apparently we should be fighting.
Yeah, no. Yeah,
And they're done.
right. Yeah.
You shouldn't have been doing it this time.
Is it coming up on you?
County health ranking collects data from multiple sources to analyze, translate, and communicate the health measures. County Health Ranking and Roadmap is a program through the University of Wisconsin Population Health Institute and supported by the Robert Wood Johnson Foundation. The Centers of Disease Control and Prevention conducts a behavioral health factor surveillance, which is a brief survey every year. Population and housing information is collected every year by the American Community Survey. We all know about the U.S. Census Bureau and the USDA Food Security Survey. The Centers of Medicare and Medicaid Services, or CMS, Office of Minority Health uses a mapping of Medicare disparity tool. New sources and methods called Places was used. Places is a collaboration between the CDC and the Robert Wood Johnson Foundation, and it is used for areas with a smaller respondent sample. Places provides model-based population level analysis, community estimates of health measures using the census tract and zip code tabulation, and that's across the United States. Any measure analyzed with this method cannot be compared to the previous year. Come on, baby. There it is. Oswego County is classified mostly as a mid-sized urban county. This differing classification can change the definition for certain measures, resulting in skewed data. For example, the food index, environment index, and access to healthy food is determined by how close someone lives to a grocery store. In an urban setting, close is within 1 mile. But in a rural setting, close is in a 10-mile radius. This is not going to like me.
You can always use this too. Yeah, there you go.
Okay, I'm right there. Thank you. That's what I used at the county. Thank you. So Oswego County is ranked 49 out of 62 counties in health outcomes. Health outcomes represent the current state of health, the physical, mental well-being, in terms of length of life and quality of life. We are ranked 54 for the health factors. Health factors consider, and the ranking is health behaviors, clinical care, social economic factors, and the physical environment. These rankings place Oswego County in the lowest quartile, the least healthy, in New York State. In 2022, our health rankings were ranked 47 in health outcomes and ranked 56 for health measures. So we went up 2 and then down 2.
Because they changed the way it was done.
Oh,
you
they
can't
change
compare
it
to
every
previous
year, you
years.
can't.
Yeah, right.
I do throughout this to show everyone where we're at, but how they, it's not an easy study. I could teach a whole class on this that would take me a year. And I'm trying to simplify it into one PowerPoint and pull out the highlights. So that's what I've done. So health ranking, the health outcomes look at length and quality of life. It looks at how healthy we are as a community. Length of life is calculated by the number of premature deaths. Quality of life data is based on the Behavioral Risk Factor Surveillance Survey that looks at adults ranking their own overall health, their physical and mental health in days, and it also takes into consideration low birth rates. There's our map. So please note that for certain measures, both health outcomes and health factors, some are not included in the overall rankings, depending on the year. Some of these measures were excluded due to the changes in the methodology and data collection and can produce some misleading results. Length of life. Life expectancy is not included in the overall ranking, but it is a question that is usually asked of me. So I wanted to include it in our slides, and our life expectancy is 77.9 years.
Well, how much time you got left, Mike?
Compared to what?
Just about 3 months in a year.
Well, you can compare it, I compared it with the neighboring county.
So I wanna go to Onondaga County if I wanna live to 80, almost 80, right?
Right.
79, yeah.
Well, Saratoga, you live real hard long time.
Quality of life, 13% of adults report that they consider themselves in fair or poor health. This is a decrease from the 22 ranking report where we were at 19%. And adults reported that their physical health was not as good, an average of 3.4 days in the previous 30 days. And this is also a decrease in average from 4.3 days from the 22 data report. Quality of life. Adults reported feeling mentally unhealthy an average of 5.3 days in the last 30 days. And if you compare that with the state average of 4.1 days and the nationally 4.4 days. %7 of live births with a low birth weight, lower than the state and national average, which is right around 8%. Health factors. Health factors are what we can do to modify, to improve the length and quality of life. They've been broken down into health behaviors, clinical care, social economic factors, and the physical environment. And you can see we're right at the lowest quartile, but inching our way up. Health behaviors, area to explore, were identified as adult smoking, adult obesity, alcohol impaired driving deaths, and sexually transmitted infections. Adult smoking. This is based on cigarette smoke. The use of vaping devices, cigars, chewing tobacco are not included in this indicator. We continue to encourage our residents to register for the Medicaid smoking cessation program. We continue to look at evidence-based programs that we currently do, Smoke Free for My Baby and Me, and our chronic disease self-management classes. New this year is Catch My Breath, which is an evidence-based program that we have brought into all of our school districts, and that is to help and discourage youth from vaping. Also, Oswego Health newly hired a smoking cessation counselor this year, so that will be helpful. Adult obesity, 33% of adults aged 18 and older report a body mass index of 30% or greater. We continue to offer classes such as Prevent Type 2 Diabetes and our Healthy Living workshops. We were 38% in the 22 ranking report. Food Environmental Index. There's two indicators that are taken into consideration here. Limited food, access to healthy food, and food insecurity. Food insecurity, we're at a 13%, and limited access to healthy foods, we're at 2%, which gives Oswego County an index of 7.9. We continue to offer the nutrition classes to all the school districts, and this year we're working specifically with the health education teachers to promote healthy eating lifestyle. We continue to partner with our mobile food bank with the coordination and promotion of their services. We were 8.0 in the 22 ranking report. Physical inactivity, 24% of adults age 18 and over report no leisure time physical activity. So the physical activity, and it's not during work time, so it's after work hours. Part of our community health improvement plan, we're working with school districts again to allow for them to open up their facilities so our residents can use them. Also, year 12 incentive from the New York State Department of Health. Their big focus is on increasing physical activity. This is a decrease from 29% in the 22 ranking report. (62% of people report living close to a park or recreational facility. We continue to map out all of our local trails using GPS for accessibility to all functional levels. And that is an increase from 53% in the 22 ranking data. Alcohol impaired driving deaths. 33% of motor vehicle crashes have resulted or involved some type of alcohol use. Barnum is definitely out in our community working with their school districts to promote life skills programs to prevent underage drinking. Sexually transmitted infections, 219 new cases of chlamydia per 100,000. This health behavior is why it was so important that we started up our EPT program, expedited therapy program, to reduce the spread of STIs in our community. This is a decrease from 289 per 100,000 population from the 22 ranking report. These are big ones. This is clinical care areas to explore, primary care physician ratio and dentist ratios. Primary care physicians, 2,420 patients per one physician. Although this trend is showing some improvement in the last 10 years, the ratio to population of primary care physicians is still way worse than the New York and national average, which is around 1,400 patients per physician. This one's not any better. So this is definitely another area to explore where we're seeing 2,170 patients per one dentist, and the state and national level average is right around 1,300. Clinical areas of strength is uninsured residents, preventable hospital stays, mammography screenings, and flu vaccination rate. Uninsured, only 5% of people age 16 and over reported not having health insurance. The New York State average is 6% and nationally 11%. The rate of hospital stays for ambulatory care sensitive conditions is 3,097 per 100,000 Medicare enrollees. Mammography screenings, 43% of female Medicare enrollees receive their annual mammogram. This is still better than the state and national average of 37%. And it was a decrease from the 22 ranking data where we're at 52%. But the sources from 2020 and we were in the middle of a pandemic, so I expected those numbers to decrease a little. Flu vaccinations, 52% of Medicare enrollees received their annual flu vaccine. This was increased from 49% in the 22 ranking report. Social economic factors, areas to explore, education level completed, unemployment rate, children in poverty, children in single parent households, and injuries that resulted in death. Education level, 60% of adults aged 25 to 44 have completed some post-secondary education. That's an increase from the 22 where we're at 58%. Unemployment rate, is that really rate, it's just unemployment. 5.5% of people aged 16 or older were unemployed but seeking employment. If you compare to the New York State average of 6.9%, and we did decrease from 8.9% in the 22 ranking information. Children in poverty. There are several factors that contribute to childhood poverty rates: unemployment, education, mental health, climate change, lack of nutritious foods. 23% of our children are living in poverty as compared to the New York State average of 16% and nationally 17%. This is a large increase from the 22 ranking data where we're at 19%. Children in single parent households. 24% of children living in a household is headed by one single parent, as compared to the New York State average of 26% and nationally 25%. We did decrease from 26% and 22 report. There were 69 deaths due to injuries such as homicide, suicide, motor vehicle crashes, and poisoning per 100,000 people. We have taught classes in our schools for emotional well-being, More Than Sad, for our elementary school children, and Talk Saves Lives for our junior and senior school students. There was no change from our 22 data in this. Physical environment area of strength is air pollution, home ownership, and internet access. Air pollution, the average daily density of fine particulate matter is 6.9 micrograms per cubic meter as compared to the EPA's annual average of 12 micrograms per cubic meter. Year to year, the density of particulate matter has increased, but if you look at the overall trend in the last 10, 15 years, the level of pollution really has decreased.
This doesn't take into consideration all those fires up in
No, this data was collected in 2019.
How do they measure that?
Corn mines would like to know.
I can look at, I will send you information on this and how they collect it.
I mean, they have monitor stations, correct?
They do have air monitoring.
I mean, it doesn't do any good if they're sitting in 1481 or Oswego or Fulton, and then there's none up in Redfield.
Right. I believe they're scattered throughout, but I can look into it. Home ownership, 74% of the housing units are owner occupied. This information is based on a 5-year estimate, so in 24 we do expect new results for this. This is an increase from 73% in the 22 ranking data, and this health factor is not included in the overall ratings. Internet access, 88% of our homes have broadband internet connections. This health factor also is not included in the overall rankings, but we did increase from 87% in the 22 data. And I will look into the air monitoring.
Any other questions?
Oh, Rich, did you?
You go first, Frank.
I'm looking at this nice little chart,
Roadmap?
the road, these charts that we have here,
Mm-hmm.
okay? And I'm looking at, the median household income, Oswego County is 59,400. But right underneath it is the living wage. Is that what we should have is the living wage, or is that what is the living wage? To get to the 59, I don't think the 59,400 is at $43.24 an hour. For some reason, I just know.
That's 80-something thousand.
Yeah. So we're saying that our living wage should be $43.24. Is that what this little thing is saying, or you don't?
No,
See if we can find out at some point in time. The reason I'm saying this is what have I pushed all along? I want everybody to have a living wage in Oswego County, that works for the county. And if we're saying, somebody's saying we should be at $43, we're a long ways away from it. We're a long ways away from it.
Well, if we get to $43 for our employees, Frank, it's gonna be a lot less people paying taxes in the town.
Well, I think it's questionable as to whether that's a rate per hour or,
No, I'm just asking a question.
yeah.
Okay, give me an answer at some point in time before I reach 79.9. Okay, which means that what I should do is my 401k output, I should make it to 2 years, because that's all I'm gonna live is 2 more years. Get it all paid out in 2
It's an
years,
average.
right?
It's
Okay?
an average.
Yeah,
Well, you'd be in a windfall then.
And I will, I'll get that information to you.
All right, thank you
Like,
very
get
much.
it. You're welcome.
Appreciate it.
No problem.
Anybody want to pool some money together and buy life insurance up, Frank?
Now we just have to fool, see if
You won't be able to get one because they say that I'm only gonna live to 77.9 and I'm already at 76.
That's in this county, Frank.
Do you have a question?
Yeah, well, I got a lot of them.
Go for it.
It's a lot to digest. There's actually too much in here, right, this junk. When you're looking at how, not you, when this piece of paper, I don't know who generated it, so that's me and there. When you're looking at, lifestyle of people and their health, are they looking at people that are being treated, or are they looking at people that are close to death, or, because
All different people, anyone that will respond to their survey and how they're collecting data.
so we don't know where the picture lies, actually.
No, but they do it the same across the board.
No, I get that, I get
Right.
that.
So the University of Wisconsin, and along with the other CDC, the Census Bureau, some of the data comes from the behavioral health survey that goes out every year, all that information, and they're all collected in a different way, with all different people within the population. If it says adult, it has to be 18 or over. If it's a Medicare that they're looking at, it's 65 or older, which was included in the presentation.
Right now, you had a statistic up here based on people looking for employment 16 and above.
Yes,
Did I understand that right?
you did.
Okay. Now, and maybe it's different now. I was in high school when I was 16, but that kind of skews it, doesn't it? Because a lot of your younger people aren't even getting their first jobs until maybe 20 nowadays. It's ridiculous. And Frank, you know exactly what I'm saying.
What are you talking about?
Yeah.
In those affordable housing places, people?
I don't know why that number would be thrown in there, because it skews it.
Question on the survey though is, are you looking?
For employment.
Right. Just, they're not looking anymore, Rich, they're not on there.
I mean, again, this is
They
a
might.
great report, but it needs to be broken down so we can discuss this. I mean, there's just way too much in here. A lot, you had a measure there, about the indicators like this, and you mentioned Medicare. Didn't say anything about Medicaid. They're different programs.
They're absolutely different programs. So they're only looking at Medicare enrolled participants.
Well, that would be like Frank, myself, I think you are.
Disabled.
Yes,
Jim,
so any-
yeah, you are.
Right, so you may
Medicare.
have taken the survey.
Or you did try that.
No, I
Still working. Still working.
But, you know, it's, those figures aren't in there.
He's not old.
Because you look at your, we have a lot of poverty in this county, I'll agree with that.
Yes, we do.
You know, and there's a lot of reasons why that's happening, some good, some bad, it's irrelevant. But again, we have to name the Medicaid people part of it, because most of the people on Medicaid obviously are socially or economically in both disadvantaged.
Right. This is just one health ranking report.
But it is a
I'm
report.
sure Medicaid probably does a report also. This is just the health rankings that is done by the University of Wisconsin, and it uses a whole bunch of different data sources to collect the data. I don't have a say in how they
Oh, no, I
or
didn't say
who
that.
they collect the data from. I don't disagree that other and more data should be collected. I don't disagree with you that I'm sure Medicaid does do data collection also.
Okay, now let me ask you this. A lot of questions. We as the legislators sitting here, what can we do to help improve this? Because it is ironic that, you know, we don't have a lot of people shooting the heck out of each other. We don't have we do have some accidents, I get that, vehicle accidents.
So I think the
What
biggest
can we do,
takeaway,
what do we gotta do?
so I think the biggest takeaway is, yes, they're called health rankings, but you can see that there's only so much that the health department can do. It does involve all agencies and everyone in the community to get our rankings up, because there's so much included in it.
See, I don't care about the rankings, I care about quality of life and people living longer with quality, not
Right.
laying in a nursing home and,
So anytime we had a strength, I did discuss some of the programs that we are working on at the health department. This county definitely is lacking providers, and that's a huge problem.
it's a huge problem across the country in rural areas. Because if I'm gonna go to 8 years of school and become a dentist or become even a PA, I'm not gonna work up in and I'm not picking on this area, up Oswego, it's just across the county line, and try to start and work and starve to death with my student loans, or am I gonna go to a metropolitan area where I can be paid more, have more opportunities for myself, and work? And that's an issue. And believe me, it's not just here. I mean, I read about it all the time down south when I'm down there. Same thing. Rural areas are struggling.
Vera?
Yes.
I have a question. Under the drinking water violations, the, I think it's on page 5 of 5, it says yes for Oswego County. Do you know what they're referring to there? Doesn't have anything else for the state or for the United States, but.
We have had them. It's a great question.
So are we talking about wells, or are we talking?
I don't have the answer.
Right.
At some point, we reported a drinking water violation. But I can dig more into this too.
Yeah, one of the school districts has had it 2 or 3 different times. They were doing bottled water. And again, recently, it was last year.
Like,
And a boil water advisory for Pulaski, not
Was
too
it
long
last
ago.
year? Yeah.
that's the type of thing that would make it into this.
I believe so, but I want to get more information from you on that.
Something that Vera and I discussed, and I did take it to NISAC and had a conversation with them, is we think the county's misclassified. So their perception of urban is you have an interstate running through it. And I presented this to a couple of people at NISAC and said, wait a minute, we have an interstate, but there's one very small shopping district off of that interstate all the way through the county, and that's Central Square. Everything else might be a mom and pop. I mean, you go to Parrish and it's Dollar General and a couple restaurants. So I mean, the first question we had is, does that affect our funding? And I was assured that does not. Article 28 is Article 28. It has nothing to do with classifications. It can affect this because they're looking at it differently. The other thing, which I had heard on a report they were doing one evening, and they were talking about food insecurity and food going, nationwide. And one of the ladies they interviewed, they asked her that kind of a question. They said, how close are you to a grocery store? And she said, well, I'm like 11 miles. And he said, so food is an issue for you. So if this survey says how close are you to a grocery store, that would be a problem. You know what her answer was? No, it's not. I ordered it online, they bring it, and they put it on my front door. I don't have any issues with food. So I'm not sure, as you said in the beginning, if you could take this as a snapshot and don't get too crazy either direction with it, because you've got these forms that people are filling out looking at their environment and their interpretation of the question.
Right.
Is food a problem? According to them, it is if you live, and if we're classified as urban, 1 mile to a grocery store. If we're classified as rural, what was it? 10 miles from a grocery store. And Phil, you made the comment, which is correct. Frank, you've been on this committee. Well, you've been on this committee. We remember Ching Chang, and we were way down on the rankings. We come up, and now all of a sudden they pulled that rug out from underneath us and said, oh, here's a new rug. And it's all going to be interpreted different now from this point forward. So I appreciate all the effort you put into this and everybody taking the time to hear it, because we have to know it. We have to hear it because this is going to be the benchmark going forward again, unless they take it away from Wisconsin and give it to North Dakota and say, you get to figure it out now. I don't know. Correct? Not correct?
Absolutely.
Yeah,
Yes.
we've kind of talked this over. I am working on the urban-rural question yet, because I think there should be a classification based upon population, not based on whether you have an interstate running through. Either that, or I think the state of New York needs to give us a ton of money so we can develop business along the interstate, which would actually make us more urban. But just joking, but we're not. We're not an urban county population at all. So, food for thought.
Dollar General is a grocery store. We have a lot of those.
Oh, we have that. Isn't that the one they just built up in Parrish not too long ago, right? You can see it right on the interstate.
These yellow ones. They're everywhere.
Yeah, I forgot about New Haven. It's the only thing there. Post office, dollar. Yeah. So I mean, and they carry food. Anything else? You good?
For the public health rankings, or you want me to do my report now? I at least need to pass out these.
Okay.
So, these are the snapshot of all the, it's our, what do we call it?
Thank you.
Yes, it just gives you a breakdown. All the data's in from 2023 from all the departments, and it's just a snapshot of everything we've done last year. So you have that information, and behind it is the overdose prevention division update that shows all the overdose information. Couple things, can I just share a couple things?
Yep.
So, our readiness assessment for FAB, which is the accreditation board, was submitted in February. We're just waiting for approval to move forward with the accreditation process, and that takes about 2 to 4 weeks, and we're probably at the 2-week mark, so we're waiting for them to give us the green light to go for accreditation. I mean, there's other stuff, if anybody has questions.
Rich and I, Jim, you've been here a couple of years ahead of Rich and I, and I've always said that rankings of where we stand on this ranking chart does not reflect anything about our health department, because we have individuals, groups in our county that, up north, if you say you gotta go to the doctor, say, no, I don't, okay? And they'll spend money on something else, a carburetor for the car before they'll spend, money to send their kid to the doctor. Wait until it's, time to be ready to fall over or something. But this, the health department in this county, I think, is excellent. We just have to try to educate more people on what they should be doing. And I don't know if that is even a possibility, because of what they've come down through their stages of life, that's what they're going to do.
I agree with you, Frank. It's a choice of participation.
Right, and that's
It's a personal choice.
and that hurts us, But you see it's coming into the cities more because of the more affordable housing that is coming about. Can they afford to go to the doctor? Can they afford to do this? Can they, their health is the least thing that they're worried about. It's just, it's sad, but our health department, I think, is among the top of the line. And I just wanted to make sure that I think the guys that have been in this committee and are on this committee know that where we stand. Okay, so you don't want people to go, you're only at this, and you got to be better. Well, then get people to, take better care of themselves, because the educated people that are down if you look at that zone map, it's the ones that are in those educated, areas is where their health, is, they're ranking the best. Okay, and we're not in that area, but we need to be at some point in time. Thank you very much. That's all I have to say, and I'll look for any kind of motion you guys want to make. And I'll second.
Rich? Yeah, just one thing, and again, it was one of your slides, and you talked about leisure time and physical activities.
Yes.
What's that, right, Rich?
Well, the thing is, and I'll give personal experience on it. I sentenced myself to 8 years living in Parish, New York. It's neither here nor there why. To get away from the old man, that was what I did.
That's why I'm building Dollar General.
And the thing is, when you speak of leisure time, I worked, 9-10 hours a day at UPS, had to drive 45 minutes there and come back home. But I had a small farm. And I wouldn't call it leisure, going out shoveling the crap. I was polite. In this time of year, generally, you're moving snow like crazy. And I don't mean with a tractor, I mean with a blower and shoveling out the doors and everything like that. That's a lot of physical activity. Feeding the animals, things of that nature. I don't think a lot of our people would answer that question that way. The Amish people don't know what leisure means to them. They don't have that concept because that's not how their school or how they've been raised. Mm-hmm. And they're not in this. I can tell you right now by looking at this, because they're not going to answer the question. I'll guarantee you that. Not going to happen. There's a lot of, I don't know where we actually stand. I know that there's a lot of, and one thing I do know, and I know this for a fact, and we have a lot of, and neither we're here nor there, but we have a lot of problems with cancer in this county, big time. Mm-hmm. And yet we can't get an answer why. And that's something that bugs me. I've lost both my parents to it and things of that nature. And there's a lot of things that this doesn't cover. And we have to know this to solve the problem. We're supposed to be problem solvers. That's what we're supposed to do. We're supposed to provide services to our constituents. I can't do that if I don't have their information. It's not you. You do a great job. you're not going anywhere until I'm dead. But the thing is, there's just too much, there's just so much that we can do, and that's what frustrates me, is I don't know what I don't know. Okay, yourself.
I have a question. Do you have any idea how many people were surveyed to get this information?
They're different for each indicator.
Is there a number or is there a percentage based on population?
That's why they started using the new places, because if they got smaller samples, every single one of the indicators is different, is my answer. It's very complicated of how this is all put together.
Yeah, it has to, because I just don't think accurately reflective.
And most of the information comes from 2020 for the 23 data. Some of it before then, some of it after then, but there is a lag.
The overdose prevention division update, the suspected overdose fatalities, is it 5?
Is that the one with the little star? Let me grab that paper so I see exactly what you're seeing.
It's got down below year-to-date 1, but if you go January, February, it's total 4, February.
So far, we are at 5.
Okay. So, high trend, isn't it?
Yeah, so far we're at 5, but the deaths seem to increase. That's why we keep a little star by them, because as death certificates come in, they might say it was from an overdose.
Yeah, they come in very slow, so
And they
don't even have all the
take 6
23
months.
yet.
That's correct. We don't have all the 23 yet.
But we're at 18 for 23.
Right, I see that.
At the stars, because it may be another couple of months before
We'll
she
get that
gets
data.
the rest of the data from.
Can we get that when it comes in?
I'll keep updating it.
Okay.
So I just want to throw in a couple quick notes here. Public health, mental health. At Albany, we had a couple of discussions. Cannot go into a lot of detail, but the health department took care of some vape shops. It is in the process of being dealt with, and this county is once again a lead in the action in the state. And people that were sitting at that table from much, much larger counties were absolutely amazed that we're at that stage of what we're doing now. The other thing is we talked about some modifications in that law. We're going to get together, and this county is going to put forth a couple of resolutions to the fall conference that we come across, and kind of talked about it, and the committee up there was excited. And I didn't get a chance to tell Vera this, but as I told them that you are waiting for the go-ahead to file for accreditation, someone from a very large county said, "What the hell? Are you at that point in your population?" And I said, "Because we're good."
We are.
Felt good. So, it's nice to share that stuff. And again, Frank, Rich, I don't take that home and say this is where we're at, and this is an instant snapshot that involves interpretation of the question. What do you do in your leisure time? Physical activity. I belong to Planet Fitness. When I feel up to it, I go over and walk for a half hour on the treadmill. I don't run, I walk. Is that leisure activity? Not in my eyes, it's work. But it's physical activity. So, and Frank, you mentioned the same thing with people that are in poverty. When you get these questions and you interpret them, you may not be interpreting exactly what they're asking you. So I think that put all that together in a package, and it's good to know a snapshot.
It is.
It's great every year to at least have the snapshot. But it's not a Polaroid picture you can run around and show everyone. But maybe it is, because you know what happens to a Polaroid picture after a few years? You can't see it. It'll suddenly disappear. All right. Anything else? We don't have a motion for Frank? The man said he was gonna give it to you whenever he
I don't
wanted.
think I can do that.
Okay.
Motion adjourned.
I'll second it.
Thanks, Frank.
Oh,
Doesn't have
okay.
much time.
Yeah, he got a lot of time, that's I gotta get a lot of.